Uganda has experienced several and continue to be at high risk of recurrent infectious disease outbreak. On 20th of September 2022, the Ministry of Health declared the 8th Ebola virus disease outbreak from Mubende district, which later spread to 8 other districts across the country. This Ebola outbreak was caused by the Sudan Ebola virus, one of the 6 species of the Ebola virus against which no therapeutics and vaccines have been approved yet.
During the EBD outbreak, we had to conduct a rapid risk assessment for EBD so that we can curb the spread, and we look out especially for high-risk districts.
Following the declaration, the International Organization for Migration, IOM, conducted stakeholders' participatory mapping exercise in Mubende, Chegwegwa, and Kasanda districts in early October 2022.
IOM came in and they mapped out some of these areas that you needed help, and more so the population mobility mapping, or what we call PMM. Because being a porous district, you cannot wait at one entry. You have to know how the population is moving from one direction to the other.
The results of the participatory mapping exercise identified the high levels of risk related to the connectivity of the epicenter with major towns across the country and beyond. The study also revealed priority points of entry where heightened surveillance and other public health-related interventions were required to mitigate the risk of exporting the epidemic across international borders. The interventions by IOM were therefore designed to address the most urgent gaps in the port health service delivery at border districts as well as districts exposed to recurrent and high-risk hazards of infectious disease outbreaks, with a view of complementing the existing interventions at the national and sub-national levels. Key activities implemented under this component include heightened border surveillance, strengthened infection prevention and control, capacity building, infrastructure improvement, and equipping of port health.
We had to plan together with IOM and Ministry of Health a number of activities like capacity building, how we should equip the point of entry, and how we should make the facility meet the international standards.
To successfully prevent and control the spread of current and any emerging public health threats across the borders, the Ministry of Health identified port health infrastructure and equipment as a major challenge which the government required support.
People were working primarily under umbrellas, sheds and what, but IOM came in and brought in the FAPs.
In response, IOM supported infrastructure improvement to the borders by providing prefabricated structures to 7 points of entries and medical tents to 9 health facilities. IOM also supported the Ministry of Health to install thermal scanners to 5 designated points of entries to support health screening in high-volume points of entries. Other critical supplies and equipment provided to strengthen the border health systems include water tanks, chairs, tables, ICT equipment and audio-visual equipment to support risk communication at the points of entries and surrounding communities.
We already have water tank systems installed, unlike previously when even our colleagues at the border health in the Republic of Rwanda would look at us and they would think we are not prepared to respond to any emergencies. This time round, we are equipped and we couldn't do it alone. IOM has really done a great deal.
When we are dealing with an epidemic, everybody needs to participate if you want to succeed. And remember, it is tedious. It requires resources, it requires money. All this has been catered for by IOM.
We cannot work in isolation, and that's what COVID-19 has taught us. COVID-19 taught us that you cannot manage health issues in isolation. You must combine efforts together.
The International Organization for Migration, IOM, has been supporting the Ministry of Health over the years to implement border health interventions and cross-border surveillance with an aim of strengthening early detection of public health threats and preventing transmission of infectious diseases to new areas.
When Uganda was hit by Ebola virus disease, Mubende region was the hotspot. But as Busia district, we are at the border. And at the border, We have a lot of movements in and outside the country. And wherever there is movement, chances are high that the diseases are also moving because human beings are carriers. So when we hit with that circumstance, we called upon the partners. Thank God, IOM came along to give us a hand in the fight against the Ebola virus disease. It's not that we confirmed the case here, but it's because we had to be on the alert to avoid any risk of us contracting the disease and exporting it to the nearby country, that's Kenya.
So IOM supported us during the outbreak to distribute materials which were devolved, because there we always want to make sure that we speak with the same voice. That is, all of us as partners, we sit down, partners and Ministry of Health, sit down, come up with the same material, which we can disseminate. Each one can help to reproduce, distribute. So they supported a lot of distribution to make sure that these messages and materials can reach the grassroots people, especially the affected persons.
Less than 4 months after the first case was confirmed, Uganda's Ministry of Health declared the end of the Sudan Ebola virus disease outbreak on the 11th of January 2023.
The outbreak is over, and Uganda is now free of active Ebola transmission.
Although the outbreak was declared over, the World Health Organization recommended that the Ministry of Health implement 180 days of recovery phase to respond quickly to any flare-ups. The risk of the infectious disease resurgence and spread across the borders was classified by WHO as still high at the national and regional level given the proximity to neighboring countries and the cross-border movement and flow of people, goods and services across porous borders.
After we completed the EVD, what do we have next? We saw the Marburg also coming, and my team, they were on top of the situation to see how we can work alongside the Ministry of Health to provide them with the necessary support and assistance.
In the context of Sudan Ebola virus disease response and recovery phase, IOM implemented targeted intervention aimed at reinforcing the surveillance capacity of high-risk border and points of entry to prevent, rapidly detect and efficiently respond to outbreaks, including training health personnel on integrated disease surveillance and response, infection prevention and control, and data management. A total of 527 frontline health workers from points of entries and their designated referral health facilities were trained.
As districts, we normally have short budgets about capacity building, but we are really thankful to IOM that he has been able to train and mentor most of our health workers, specifically in the field of surveillance.
In the fight against risk factors for the spread of infectious diseases, IOM, in coordination with Ministry of Health Clinical Services Department and IPC Pillar, supported the strengthening of IPC implementation capacities at high-risk borders and ports of entry. These included trainings, providing necessary supplies and hand-washing facilities, and provision of guidelines and standard operating procedures which were a key to mitigating future infection spread.
A number of partners, together with IOM, have supported implementing IPC activities to strengthen capacities at points of entry.
IOM didn't just stop at supporting border health. We also supported the strengthening of referral hospitals across the country through capacity building and provision of necessary supplies and equipment.
They have made sure that the laboratory, which is the center where most cases, if we want to investigate, the samples are collected from, and where it requires that the samples are well kept, they have provided the refrigerators, they have provided the equipments which are needed for the laboratory.
IOM was able to support us improve a big structure, a designated health structure, and that is in Bibia, to support illegal points of entry.
They constructed isolation which is self-contained for at least, which can accommodate at any one moment 2 critical cases, which they are all handled from within the building without going to spread the infection out. They also did a bigger expansion of the outpatient department and increased the capacity of the stores and the rooms and the waiting area.
IOM facilitated the trainings and equipping of healthcare workers, village health teams, district officials and border agencies with knowledge and necessary skills to combat the spread of the Ebola virus disease, Marburg disease and other epidemic-prone diseases. This led to outstanding results and achievements. A total of 527 frontline health workers from points of entries and their designated referral health facilities were trained on integrated disease surveillance and response, IPC, and data management.
And really, after that training, we were able to coordinate very well because every stakeholder was involved.
Bwebasomesa twasooka kukyanyu tumanya nti tuweddewo naye abasawo baatugumya naddala ekitongole kya IOM bwe kyali tebikozesebwa mu maka gaffe mu byalo gye tuva okusobola okulaba nti twetangira nga twali twakava mu kirwadde kino ekya COVID ate ne tugwa mu kirwadde kino ekya Marburg. Bwe batusomesa wamana tetwatya ne tutatya olw'ensonga nti baali batuwadde information entuufu.
IOM also held community dialogues on the current public health threats and other emerging diseases affecting the border communities. A total of 1,026 individuals were reached with risk communication and community engagements, key messages and information on Ebola virus disease, Marburg virus disease and other emerging diseases in the region to increase awareness and mitigation measures at the relevant points of entry.
Ebola made everybody panic. It was like we are going to another lockdown. This was like we don't know what it is. And we have heard about Ebola on the other end of the western Uganda, but we have never had the experience with it. So it was like we don't know what may go on with us around here.
People had a negative attitude toward this Marburg and the COVID. But when IOM came in, people changed their attitude.
VHTs are very alert. Even if somebody has some blood oozing from the nose, which is a long time common happening, our VHTs will be on alert to keep checking to see whether it is some strange thing happening or it is the normal.
Kati nga ffe ba VHT ne bwonsanga n'ombuuza mu Marburg kyeki era nkubuulira ti Marburg bwe bulwadde bwe buti bukwata bwe buti sayinizi zaabwo zonna bazitusomesa tuzimanyi era tufubye nnyo okulaba tugenda tubunya amawulire ago mu byalo byaffe agakwataganye n'ekirwadde ekyo.
To ensure effectiveness and greater impact in the fight against infectious diseases, IOM supported stakeholder meetings as well as cross-border meetings to coordinate pertinent issues relating to global health security and border safety in line with international health regulations at the points of entries. IOM particularly facilitated 2 high-level cross-border meetings between South Sudan from the 5th to the 7th of June 2023 and Tanzania from the 22nd to the 23rd of June 2023 in coordination with the Ministry of Health, WHO, among other stakeholders. As a result, IOM is committed to continuously supporting the government of Uganda in ensuring the borders are safe from exporting or importing epidemic-prone diseases.
We are here to support the Ministry of Health to continue providing support at the point of entry.
On behalf of the country, I am very pleased that we have received these donations to the 80 districts which are bordering our neighboring countries. And as a country, we have been building a very strong working relationship, partnership with our neighbors to ensure that we manage, we detect these pandemics at our cross-border entries. And I want to thank finally all our partners, IOM, USAID, World Health Organization, name them, who have been with us and stood with us.